Hi, my name is Dr. Kathryn DeLonga. I'm a licensed clinical psychologist and director of the Psychological Treatment Program with the Mood, Brain, and Development Unit in the Emotion and Development Branch here at the National Institute of Mental Health. I have nothing to disclose. All the opinions I'm presenting are my own, and they're not intended as a substitute for medical or psychological diagnosis or treatment. And all of this work is supported by the National Institute of Mental Health Intramural Research Program. The Mood, Brain, and Development Unit is a lab that studies adolescent depression, led by Dr. Argyris Stringaris. We work to improve the understanding and treatment of adolescent depression. In the short talk today, I'll be talking a little bit about what major depression is, how common it is, signs and symptoms of major depression, and what to do if you or someone you love may be experiencing depression. Major depression is an illness of brain circuitry and chemistry, and it causes changes in mood, thinking, motivation, and behavior. Some of the core symptoms of mood changes might be irritability, sadness, or loss of interest or pleasure. And the symptoms can be clustered into these groups, so some change in thinking, some changes in mood, and some physical symptoms associated. And sadness is something that we all experience. It's a normal reaction to a loss or setback, but usually passes after a little time. And depression is different. There's a range of symptoms that might start sticking around more days than not for multiple weeks at a time. And it could be the sadness and anxiousness, irritability, loss of interest or pleasure, thoughts like thinking that you're less worthless, more worthless, helpless, guilty, starting to withdraw from things behaviorally, grades might drop, engage in risky behaviors, can have thoughts of death or suicide, self-harm, difficulty concentrating, the physical changes, changes in eating or sleeping, loss of energy, feeling restless, aches and pains, stomach aches, headaches. And you might not experience all these symptoms, and maybe not even multiple at the same time, but for more days than not, for multiple weeks, you might experience a range of some of these things. Major depression is among the world's leading causes of illness and disability. It's very common. It's one of the most common mental disorders in the U.S. And what we know is that it rises during adolescence. So in 2016, just under 13% of the U.S. population ages 12 to 16 experienced at least one major depressive episode. In childhood, rates of depression are generally pretty low, with numbers equal across boys and girls. But in the teenage years, a time of huge brain and physical and social changes, there's a sharp rise in the rates of depression, particularly among girls. And while race or sexual orientation aren't predictors of depression, social isolation, bullying, and fear of being targeted or not feeling supported or accepted for one's race, gender identity, or sexual orientation are. When we think about what causes major depression, we know that it's a brain disorder and affects circuits and chemistry, and we know that it could be genetic. It often runs in families, but it's a combination of genes and environment that would contribute to a first major depressive episode. And sometimes if a parent or another family member in a household is depressed, a teen may be more vulnerable to depression themselves. Stressful life experiences, such as abuse or being bullied or an injury, can be factors that lead to depression. And additionally, medical or psychological factors, an endocrine disorder or substance abuse, underlying anxiety or learning issues could all lead to major depression. Untreated, a depressive episode may last 4 to 8 months, and without treatment, recurrence is likely. So we often think of even adult depression as having an onset during teenage years, so that depression is something that can wax and wane, but then often does come back without treatment. So what are some of the treatments? It may include psychological or talk therapy, such as cognitive behavioral therapy, which addresses the thoughts and behaviors that are part of a depressive spiral, or interpersonal therapy that would address relationships, social skills, grief, role transitions in life, or attachment-based family therapy. Additionally, for moderate to severe depression, medication can be helpful. The strongest evidence currently in treating depression in adolescents is for the selective serotonin reuptake inhibitors, or SSRIs, such as fluoxetine or sertraline. And medication may be particularly effective when paired with psychological therapy, such as cognitive behavioral therapy, or CBT, as this is shown to be protective against the possible side effects of medication alone. For things to consider when choosing a mental health professional, please see this website on the NIMH website. And so what are the steps if you're interested in getting help? First, talk to your parent, guardian, or a trusted adult. And if you're not sure where to turn, you can even text a live mental health professional by texting the word SAFE and your current location to 4HELP, which is 44357. And the second step would be to make an appointment with your doctor for an evaluation to make sure that there's no medical issues or safety issues that need to be addressed, to talk about what you're experiencing and ask for a referral to a mental health professional. If you're considering suicide or harming yourself, if you're in a crisis right now, talk to your parents or trusted adult. You could also reach out to trained counselors through free confidential resources that are available 24 hours a day, 7 days a week. This National Suicide Prevention Lifeline is available at 1-800-273-TALK, so 1-800-273-8255. You could text the crisis text line by texting the word CONNECT to 741-741. The Trevor Project for LGBTQ Youth and Allies is a great resource, manned 24/7. Their number is 1-866-488-7386, or you could call 911 or go to your nearest emergency room. And if you know someone who you're worried about who might be in crisis right now, the first step is to listen, to be there for them, to ask them what they've been experiencing, and you can even ask directly, have you been having thoughts of killing or harming yourself? Research has shown that asking at-risk individuals doesn't increase suicides or suicidal thoughts, and you inquire about a plan. And additionally, if you have a home in which there's a depressed teenager, removing access to lethal means, making sure guns are locked away if you have them, making sure medications are locked away, and involving then mental health services can be particularly important. Help your child connect to a crisis line counselor, a health professional, another trusted adult that can help get something in place to help improve the depression, and then stay connected and follow up with your loved one. And if you're someone watching right now who's experiencing major depression, I encourage you to reach out for support. So depression is one of the most common mental disorders in the U.S., and you're not alone. Sometimes living with it can seem overwhelming, so it's important to build a support system for yourself, to talk to family members, friends, your doctor, to reach out for help. And please feel free to visit us for more information and to learn more about some of our studies and treatment programs that we're offering for teenagers experiencing depression. Thank you for your time.